Lyme disease. That's actually what the bacteria look like. Pretty gross. That's looks very close to roundworms. Fastest growing vector-borne disease in the world. 85% of people who have it do not remember being bitten by a tick. Less than 70% develop a rash, and that's because it's mainly the adult female ticks who leave a rash when they bite. The smaller ones don't, and they're just as virulent. Treatment should begin without testing if a rash is present. Lab tests may be negative for up to the first 6 weeks after you've been bitten and developed that bullseye rash. Normal early symptoms are very similar to anything. You know, a lot of people talk about getting a flu shot right now. It's very big. And they'll say, I got a flu shot, and then the next couple of days later, I got the flu anyway. Well, you didn't get the flu the next day. You got what we call an acute phase reaction, which is what the vaccine is intended to do, which is ramp up your immune system to attack whatever virus is in the vaccine. The problem is that has other scorched earth consequences that I'm not going to get into. Also, one of the other big ones is somebody who has none of the other parameters and all of a sudden out of nowhere develop Bell's palsy. Everybody know what that is? You get the face droop on one side. Now, here's the problem. If you are, let's just say you're unfortunate enough to be bitten and develop a rash, so you right away know that you have Lyme disease. Most people don't take antibiotics for long enough to get rid of it. Most people only take it for about 10 days, at most sometimes 2 weeks. The International Lyme-Associated Diseases Society requires that anybody who knows they have Lyme disease in that acute stage should be on a very specific antibiotic called doxycycline for at least 6 weeks, or more in some cases. And a lot of times, a lot of doctors that do a lot of Lyme treatment will try to do them by IV if possible, just to make sure that they're killing this thing off. Because once it's in your system, it's very, very difficult. In fact, it's unknown if anybody actually ever even gets rid of it, because we don't have testing that's sensitive enough to determine that. However, if you undertreat or you don't ever knew you had a rash in the first place and you develop what we call chronic Lyme, or there's a very prominent Lyme MD researcher that instead of calling it chronic Lyme, he calls it multi-system infectious disease syndrome. And these are the symptoms of chronic Lyme. And again, pain, fatigue, arthritis, sleep disturbance, pain, chronic pain.
This could be easily found on a blood work.
This can be, I wouldn't necessarily say easily because it depends on the lab. But when you do testing for Lyme, there are only so many labs that do the correct version of the test to give it the most appropriate accuracy. Probably the most common one people use is a lab called IGenix, and they're out of California. The lab that we use, another good one is Fry Labs. Another one, and this is the one that we use, is called Pharmason Labs or Neuroscience Labs that are out of Wisconsin. And they will check for Lyme disease as well. Those three labs are probably the best that's out there. Like if you're just going to use like Quest or McLaren or Genesis or any of the local labs, they're going to use the old version of the test, which it literally only accurately picks out about half of all people who actually have Lyme disease. So it's frankly not worth doing in a lot of cases.
I heard recently that Lyme was also can be passed from person to person.
That's true. It can be passed as a sexually transmitted disease.
That's how it's passed?
Mm-hmm. Basically what happens is the reason why it's such a powerful transmission by tick bite is because tick saliva has a property to it that inactivates the host's immune system temporarily. So when a tick bites you, it literally buries its entire head and jaws into your skin.
Right.
And if pulled off inappropriately, its stomach contents are injected into the host's body. The Borrelia live in the tick's stomach. And they use the saliva then to kind of piggyback off the benefits of the saliva, because now the saliva is inactivating all the immune cells even within your deeper levels of skin, so that now the Borrelia, which is by itself a very weak bacteria, can burrow into the skin and then start instantly trying to hide in your bloodstream. And the reason why it's shaped like that corkscrew like that is because it literally burrows in and out of tissues, just like a drill.
Jason had a tick.
It's
My
disgusting.
son had a tick in his head. He came back from Tennessee and he said, Mom, I got a bump. And he had a tick in his head.
That's most commonly where they stay the longest because the hair covers them. It's hard to, nobody knows.
Maybe I should have him tested.
So, one of the things we do, if we have anybody have it, we have them try to save the tick and have the tick tested.
Correct.
And it's a much more accurate way of determining if that tick transmitted anything. Because not only will they check it for Lyme, but they'll check it for any infection that tick might have had. Signs and symptoms of Lyme: fatigue, pain, depression, sleep disturbance, irritability, pain. Again, chronic pain. Noticing a theme. And it's not like this is new information. I mean, this is New England Journal of Medicine, 1990. So this has been common knowledge for quite some time. Lyme treatments, antibiotic therapies. Like I said, the most, for example, there's a Dr. Ledke here in Saginaw that treats a lot of Lyme patients, and there's a Dr. Markowitz down in Kego Harbor, I think, is where he's at. They use a lot of antibiotic therapies. They're both MDs. And they do a lot of IV antibiotic therapies. The typical antibiotics they use are doxycycline and something else called Flagyl or metronidazole, and they use them in combination with one another. There's no question that they work. The problem with antibiotics is you're trading a problem for another problem. And I probably don't have to, being that you guys are all here listening to somebody like me explaining my version of all this, you probably understand what antibiotics do to the body. But there are times when it's necessary. And so when we use them, we bite the bullet and use them. Instead of doxycycline in our office, one we found that's actually worked better, is more tolerable for a lot of people, is something called Bioxin. And the difference in the mechanism of action is that the antibiotic Bioxin actually penetrates all your cells. So if you have any Lyme or any co-infections hiding inside of a cell, those also will be killed off easier than the other two. Secondly, in a lot of people with Lyme, they have a lot of chronic viral infections that are also allowed to kind of creep up on them. For example, many people have had mono as a child. And so what happens is that Epstein-Barr virus always stays in your system, no different than chicken pox can become shingles later on, et cetera, et cetera. And again, going right back to the beginning, what determines if I had chicken pox as a child, what's going to determine for me down the line if I get a shingles outbreak?
Your immune system.
Right. And what triggers that? Stress. Right? So, again, we all probably have chickenpox virus in our system. Some of us are going to get shingles, some of us aren't. Not because of anything with the virus, but because of our body's ability to keep it in. When you start to get chronic infections, those old viruses now can start to creep up and cause problems again. And so those have to be dealt with also. So there are different, for example, acyclovir, which is a common medication given for herpes. We will use in a very short term to help their viral titers come down faster. Because you can run into a situation where if your immune system is already severely depleted, especially when you have something like Lyme disease, you can have an issue where you have way more, it would be like, anybody see the movie 300? It's kind of a gross movie, but basically King Leonidas fighting the army, literally 300 soldiers against millions and millions and millions, and ultimately, obviously, they succumb. Well, that's what happens when your immune system is fighting chronic infections, plural. You have all these viruses in the system that are there. You have now the introduction of new bacterial infections, probably opportunistic fungal infections like mycoplasma and some other things. And so you just have all these things out here in your immune system. It's like, where do I start? And so having the antiviral therapies at least knocks down one group of those for a short term to allow your immune system to kind of get back on its feet. Not something people stay on by any means, but it does in some cases help people kind of get over the initial hump to kind of jumpstart the process and at least get them feeling better faster.
So the antiviral is not an antibiotic?
Correct. Correct.
You can't cure Lyme disease, right?
Nobody knows if you can cure it or not because there's no testing to know. Once somebody's gone through treatment, how do you know if you've eradicated it? If it's so elusive, a lot of times it's not going to show up on testing afterwards anyway, so you can't really know.
So they're in good shape.
So we typically say we try to put somebody in remission. Most people who do just antibiotic therapy will stay in remission for periods of 3-4 months at a time and then feel bad again. Our goal is to keep people in remission for months and years. And then that's how we know we have a pretty good handle of it. But again, it's about keeping the body built up and being able to handle any infection, regardless of what an infection it is, so that they're not as likely to feel the effects of it later on. Instead of the antibiotics, two herbals that are commonly used. Again, they have to be used in combination with one another. One is called banderol, and the other one is called cemento, or cemento is also known as cat's claw. When those two herbs are taken together, they produce the exact same amount of killing power to Lyme disease as the two Flagyl and doxycycline antibiotics. And of course, you don't have the other negative GI side effects as a result of it either.
What was the name of that again?
Banderol and cemento, S-A-M-E-N-T-O.
Flagyl and doxycycline.
Yeah, those are the antibiotics. And according to the literature that's out there, if you use either two of those combinations, it will kill, whether it's antibiotics or the herbs, it will kill all of the Lyme, all forms of the Lyme, and I'm not even going to get into that. All forms of the Lyme, 85 to 90%. So it does have, it's the best combination that's known for at least present day. And then finally, immune boosting therapies, things that are going to help your numbers increase fast. There are two ways to do that. You can either increase the number of immune system cells, so increasing your soldier count, or you can improve the weapons with which they're fighting, which are antioxidants. So things like vitamin C, which a lot of times we will do by IV also, to give them so much of it. It's like giving your immune system serious ammunition, if you will. Glutathione is another very powerful one that you can use. Selenium is another big one, and magnesium are probably the three biggest ones that your immune system will use. Auto, yes. Yep.